Source Nation. Tonight's program was brought to you by KVEL Products, the original all-natural transition from chemical to natural with KVEL Products.
Welcome back, Source Nation. You're listening live to Healthy Living with Dr. Julissa.
Good evening, Source Nation. Good evening and welcome to SRN Live Television. You're watching live right here on Healthy Living with Dr. Julissa Hernandez. Tonight's conversation is going to be an excellent one. I want to thank our Source Nation family members for sending this excellent topic in. Tonight's conversation will be on multiple sclerosis. So what we're going to do is we're going to bring Dr. Julissa in tonight. She's going to introduce herself to you all, and we'll get into our conversation from there. Dr. Julissa, hello and welcome to Healthy Living. How are you this evening?
I'm feeling great, my dear friend. This wonderful hot weather has us feeling alive this summer. And you, I hope you're well.
Yes, great weather here in North Carolina. You know, I can't believe that summer is ending, but it's ending on a bang because we are experiencing 90, 95-degree weather, beautiful sunshine. I'm loving it, you know, and especially with the nights ending like around 9. I'm able to get outside a little bit more, so I'm happy about that.
It's actually clinically proven that people are more joyous and happier in the summer months because of that natural vitamin D. So yes, that makes total sense.
Awesome. Well, I am excited to have you here this evening. Again, thank you so much. But if you will, please take a moment to introduce yourself to all of the brand new family members that we have listening to Healthy Living, and we'll jump into our conversation from there.
Thank you so much for having me again this evening. Hello, Source Radio family. Hello, Source Live Television family out there. My name is Dr. Julissa Hernandez. I am a board-certified naturopathic doctor, practicing now for over 23 years, an international teacher of natural medicine, speaker of natural medicine, television and radio personality, and absolutely honored to be able to be part of your health journeys in sharing information here with your amazing hostess, Kathy B. Thank you so much for having me.
Awesome. Thank you so much, Dr. Julissa. Again, Source Nation, tonight's conversation is going to be on multiple sclerosis. We had someone to send in some information in reference to the recent diagnosis, Dr. Julissa, and wanted to pretty much talk about some ways to continue to keep the body healthy. There has been a medication introduced to our family member, which is, I believe it's Tecfidera. And what I want to do is just share with Source Nation, if I may, information in reference to multiple sclerosis, what I found it to be, and then you can go ahead and elaborate from there. Would that be okay?
Absolutely, please.
So Source Nation, anything that I source, I will let you know. I actually got the clinical definition from WebMed, and this is what it stated. It says multiple sclerosis is a problem with the immune system called an autoimmune disease. It also targets only the bacteria, virus, and other invaders, such as the immune system, and it mistakenly attacks the body's own tissue. It also affects the brain and spinal cord. So what are your thoughts, Dr. Julissa, on that? And is that pretty much true to what they have given definition to?
Yes. However, I'd love to break it down in a different perspective that maybe our SRN family out there can understand a different way. For literally 500,000 Americans, or now we know that the number is much more, multiple sclerosis is progressive.
Okay.
It is a progressive nervous system disease. Wherein what happens is the myelin sheath that's wrapping the nerves is damaged. And just to get a visual on what I mean by the myelin sheath, if you look at a wire, a copper wire is usually covered by the rubber exterior, plastic or rubber exterior. That exterior is what's damaged. Think of the copper wire in the center of any wire as being the nerve itself, and the myelin sheath is what's covering that copper wire.
Okay.
And what happens is that it's damaged, and it's triggered, multiple sclerosis, it's triggered by an autoimmune reaction. So wherein the immune system is definitely attacking itself. Okay, it's attacking its own cells, it's the body itself. To viruses, in reality, there has to be, normally there's a presence of viruses like herpes in a person who has developed multiple sclerosis, or Epstein-Barr. And the immune system, it creates antibodies to the brain's myelin, which then bears really an uncanny resemblance to the viruses. So research has linked that really low essential fatty acids that we get from having extra virgin olive oil, that we obtain from eating nuts and seeds. So low essential fatty acids, and even a lack of vitamin D, which you just actually commented on. It makes you feel joy this summer to feel that sun and be able to go out and expose yourself to feeling that natural vitamin D. Lack of vitamin D has been known to be one of those links to multiple sclerosis.
Okay.
And that lack of vitamin D to myelin sheath degeneration, which is what happens. Again, we're talking about the myelin sheath being damaged. So it's almost like the nerves are literally exposed.
Okay.
And that's why they tend to feel so much pain, the people that suffer from MS. Myelin naturally, just so you know, very high in essential fatty acids, EFAs, which you get from omega-3, which you get from flaxseed oil. You also get, as I mentioned, from extra virgin olive oil and so on. So multiple sclerosis must be treated vigorously. A little bit of therapy, as far as what we see in natural medicine, does not work. We need to douse the body and really bombard the body with extreme nutrients and herbal natural therapies, because the medications that are given, as the family member stated, will bombard the liver with time. And that's why I do everything in my power to really nourish the body so much so that they can slowly, along with the help of their conventional doctors, slowly wean off of the med, because the liver is going to suffer with time if they stay on it. And it never really truly corrects the problem. It only appeases a bit the symptoms that they're dealing with. So a little therapy doesn't work, but long lasting remission is absolutely possible. I've proved that before. Natural therapies will take a good 90 days. I've proved it 60 days to 90 days to really start kicking in. And again, it has to be in high dosages. And if they've been suffering from this for years, giving yourself a good, 60 days to start really truly feeling alleviation and being able to start weaning off medication is not a long time in my eyes. The multiple sclerosis drug treatments, they fail most of the time, and this person will be able to most likely give us their review of how they've been feeling since they've been on it, but they have a lot of severe side effects, and my main premise is that they bombard and weaken the liver. Okay.
I'm glad that you said that, because what I do know of what the person shared with me and shared with us was the fact that they find themselves sick often. It somewhat feels as though they have a common cold, possibly the flu. The fact that the pain is severe, it can put them out of commission for a few days. It is hard for the strength, the body's natural strength, to be seen and there for them. I can share also the type of medication that is prescribed doesn't seem to be working. So with that said, my natural thought is, okay, if we were to bring in natural medicine, maybe we can assist in the areas where it's not, as far as giving more energy, okay? not feeling as though they have like the common cold or the flu. What are your thoughts on that?
Absolutely. In the focus of natural therapy treatment for multiple sclerosis, strong immune defense is essential to their healing. ALS is another very similar form of multiple sclerosis that's known as the Lou Gehrig's disease, for those of you out there that have heard of that. And this affects the skeletal muscle nerves, also progressive muscle wasting.
Okay.
The person really tends to have challenges even walking. I've treated patients that have been brought in via wheelchair when they first met me because their body's so weakened and the pain is so severe. And with that muscle wasting, the muscles really lose their nerve supply. So we need to treat the nerve damage first when we focus on this within the realm of natural medicine, and then we work to literally restore muscle function and immune health. So that's the way that we go about it. Some people tend to use histamine therapy, which can show very good results, and I do bring that in herbal ways that help to be natural histamines that also help in that. I know people that have tried, for example, stem cell treatment, which is also known to remove damaged white blood cells from multiple sclerosis, and this replenishes them with the patient's own bone marrow when they do stem cell treatment. And this is also known to be very promising along with natural therapies. But when we have a moment, I would love to share some of the symptoms that let the person know if they are at risk of MS.
Sounds great. We'll get to that because that was one of my questions that I wanted to speak on. Now, before we get to that, let me ask you, Dr. Julissa, if you could share with Source Nation, with the Source Nation family, what causes multiple sclerosis, and is this genetic?
Very good question. Malnutrition and stress are what usually precede a multiple sclerosis diagnosis.
Okay.
So knowing that malnutrition is not genetic, and neither is exposing yourself to extreme levels of stress genetic.
Okay.
So maybe inheriting a tendency for a low immune system, fine, but to actually say that you inherited MS, no. In naturopathy, we don't view it as such. So Candida albicans, an excess of yeast within the body, is also known to be a precursor, because again, we're talking about an immune system challenge, an autoimmune system challenge, wherein because the immune system has hit rock bottom to that point, that autoimmune reaction of the body attacking itself happens because the body's weakened. And that's always something that can be prevented. So these are the types of things that we know precede MS. And having a body very toxic and so on. All the things that can weaken an immune system will make you susceptible to these things. And I have more of a list here to share with you so that people can know if they're even at risk of developing it. I'll go over that.
Okay. My next question was, talk to Source Nation, if you will, in reference to symptoms. What are some of the warning signs that are very dramatic to an individual that may be on the verge of multiple sclerosis?
Great question. How to know that, and if you're at risk? The initial onset of multiple sclerosis very much relates to feeling tingliness in extremities, tingling, feeling numbness, fatigue, and it usually occurs between the ages of 30 and 45, which is a very interesting phenomenon. If you think about it, between the ages of 30 and 45, usually that is when we're thinking seriously about settling down, thinking
Right.
seriously about getting into a significant relationship. We are considering really having already maybe begun our career, our true career path, right? And now driven to become something. Now we're thinking of saving for retirement and things of that sort. We're raising children, and the levels of stress have grown. Remember,
Right.
I mentioned malnutrition and stress tend to be the things that precede MS. So that's a very interesting phenomenon. And more often, this tends to happen in women. We look at it again and the role of the woman, we have to be nowadays in 2018 in our masculine energies, in the business world, in the career world. So we're not, for example, eaten up alive, but then we have to switch that hat and be soft and be feminine and be mothers and be wives and so on and so forth. So the stress has accumulated usually in that age frame, which is fascinating. Most
Right.
people who develop MS are between that age. Do we know, before I continue, the age of the family member, the Source Nation family member that sent in the question?
Right. I'm so glad that you asked. It is a male,
Ah,
and he's 50.
okay. And he was diagnosed recently?
Yes.
Okay, all right. So that is what normally the statistic shows as far as numbness, tingliness, fatigue occurring between the ages of 30 and 45, and usually more often in women. Now,
Okay.
there also tends to be blurring of the vision, visual loss, some loss of vision there,
Mm-hmm.
seeing double as well, double vision, eyeball pain. All of this also follows. Other symptoms that tend to set in are slurred speech, breathing difficulties, a staggering gait where they're not really walking in a balanced, uniform way, right? The person may experience also tremors,
Okay.
dizziness. Many times, and I've encountered this with my female patients that have come to me with challenges of MS, these women tend to have issues of bladder and bowel problems that really result from the partial paralysis onset. Mind you, with multiple sclerosis, there is much of the time some paralysis.
Mm-hmm.
Now with men, and I don't know if the gentleman has shared this, men tend to become sexually impotent, and this is because the nerves have degenerated.
Okay.
Some people confuse, and it's important that I mention this, some people confuse the symptoms because they mimic Lyme disease. So an MRI is what's typically used to diagnose multiple sclerosis.
Mm-hmm.
But sufferers soon are really able to track their illness and really keep in mind what a lot of their symptoms are. And what's used usually is OCT, which is optical coherence tomography, which
Okay.
they use to kind of determine that. But those are the symptoms that set in. And it is more prevalent in women than in men. But men are definitely sexually hindered when this nerve problem has set in.
Okay. All right. Source Nation, you're watching live right here on Healthy Living with Dr. Julissa Hernandez, watching live on SRN Live Television. Tonight's conversation was all about multiple sclerosis. Dr. Julissa has given us some very informative information about this particular disease. Now, my next question, Dr. Julissa, MS is not considered a fatal disease, correct?
It's a degenerative disease.
Okay.
The person will start to waste away if they don't really get this under control.
Mm-hmm.
If they don't get it under control, it will start to really take over, and the damage will continue progressively. If, for example, even sugar levels are not kept low. So I have encountered people that have come to me with MS that are diabetic, with high sugar levels. So keeping sugar levels low helps greatly. Um, Exposing themselves to sunlight. What happens is many people with MS are in so much pain, they then stay indoors more, and they're hindering themselves because they actually need sunlight and vitamin D to help put the MS in remission.
Mm-hmm.
And once I get them better, I tell them they need to go on vacation and to go to the Caribbean and to expose themselves to the healthy sunlight without putting on chemicals on their skin of sunscreen and so on. Let the natural sunlight hit you, absorb that natural vitamin D a good 15 minutes to 45 minutes per day, and expose themselves to the good healthy salt water and so on. It just that's needed to help with the MS in remission. So there are far less incidences of the disease in sun belt regions. That's another interesting phenomenon. You'll find that you will very rarely find this sort of a health challenge in sun, sun belt regions of the world. So mild daily exercise, very much needed to help the body in getting better. And then the therapies that I recommend, what their function is. It's to build strong nerve structure again. You need to preserve the brain cells as well, because feeling foggy minded, feeling that they can't focus the same. I've even had a patient that came in where again, there was also slurring in the speech. So if I'm going to share some herbal therapies that I tend to give for that, I would love to do so.
Okay.
Spirulina, greens, sea greens are very needed to nourish the body with. So that's a wonderful nutrient that a person can start incorporating in their diet. Anything that's going to help renew the liver. So I love to use herbs like milk thistle, which also helps with such, and catnip, which I very much love to use orally and also in the form of an enema to help bring that in so that it starts working on the liver as well. But it's a wonderful nerve tonic herb that I give to people who've even been dealing with seizures, as I'm treating a 14-year-old right now, for example, with that challenge, a young girl.
Okay.
Diet-wise, red meat must be reduced, or I would say eliminated. Must be. Okay? Dairy food as well must be either reduced or eliminated altogether. Okay? And bringing in healthy essential fatty acids, flaxseed, extra virgin olive oil. If they're not vegetarian, then omega-3 supplementation as well, very much needed. And the diet has to consist of 70 to 80% of fresh foods. So
Wow.
eating more fresh fruits and vegetables, our family member out there. But seaweeds and sea greens, as I mentioned with the spirulina, very much needed. Sprouts, legumes, seeds, they can get all of those natural essential fatty acids from those things as well. And remember, it was malnutrition that tends to bring this about in the first place. The person was not taking care of themselves well.
Wow. Good information that you are sharing there. Now, let's transition over to the fact that we are diagnosed with multiple sclerosis. We know that there are things that we must implement to make that change. Let's talk about that change factor. And I'm a firm believer, if you are diagnosed with something, you have to remain positive. So can we turn that around? Can that person still be active or become active? Do you suggest that? Because you mentioned, going out and getting the natural vitamin D of the sun. So let's talk about that. Becoming active, even though this was your diagnosis.
I very much am a believer of what Chinese medicine teaches us. And it's over 5,000 years old, so who are we to argue it, right? Very much of the time, it's a lot of emotional challenges that tend to precede physical challenges. And I mentioned a moment ago how stress and malnutrition set in, but let's talk about that stress and that emotions. And the first thing that I would recommend to a patient is that now the focus must be on them.
Right.
So when you ask me, can they do that turnaround? It's not can they. They must be so sick and tired of being so sick and
And tired. Yes.
that they need guidance to know how to overcome that. But when I have that patient in front of me, as I tell all my patients and anyone of you that are my patients out there that are watching and on the show right now, I always say, leave your body to me. That's our job to do together, to know what we need to keep your body together so that your body can start to heal itself. However, I need your help with the emotional. And so now it cannot be a complete focus on just the kids, just the spouse, just the parents or family members and so on. It must be now a focus on you.
Yeah.
You must now become self-centered, obviously in a good way, self-centered, and focus on yourself, because you cannot be a good parent, you cannot be a good sibling, you cannot be a good spouse, a good employee, and so on if you are sick.
That's right. That's right. Take time for yourself and take care of yourself is what I'm hearing you say there. So
it begins there. So that mental shift of how it is not ego, it is not a bad thing to be self-focused, because now the example is here. You're deteriorating. You feel like you're falling apart. You feel like you cannot function because all the focus has always been on the other, on your beloveds, and not on thyself.
right. Right. Great information there. You know, when we talk about multiple sclerosis and we talk about the treatment, we just shared with the Source Nation family some of the things that we can do from a holistic and natural standpoint. The medication that has been prescribed and the doctors are pretty much treating the patients with, what are your thoughts about coming off of that and totally going a natural holistic route? What are your thoughts on that? Should they continue the medication which is given to them, or natural all the way? What are your thoughts?
Just like their conventional allopathic doctor cannot tell them to stop taking whatever, if they were my patient, I would recommend. I cannot say that they stop it. However, all the while, I will be substituting with natural therapies. Know about multiple sclerosis drug treatments and that they often fail. And it is only going to mask symptoms and never heal the body. So the side effects are too much. So know that, yes, it will be a work where they will be able to wean slowly off of them. But if you feel worse on them, why continue? I say I'm the biggest advocate of one listening to their bodies and really taking into account how they're feeling once they've begun a drug. Not everyone responds the same. And know that there are natural therapies there that help to alleviate such challenges. And I'll share some of that information on links as well that we can.
Awesome, awesome. Now, and my last question, you know, we talked about that this could, this is an autoimmune disease, and it can affect the tissues, it can affect the liver, it can affect the brain, correct? Okay, so with that being said, in order to treat all of that, the medication that is being prescribed, does that weaken all three areas as well?
It's going to cause side effects, and it depends on the medication that they're given. But one thing that is for sure, because the liver is the chemical plant of the body, and
Right.
all drugs and all medications have to be filtered through there. We already know that that's a challenge. The liver needs to be cleansed. The liver needs to be focused on. And marked improvement has been shown from working and strengthening that organ. Okay? Then why take something that's going to poison and affect in that way when it's trying to correct another, but it's going to destroy another? It's
Mm-hmm.
something to take into account. Again, my biggest recommendation is to listen to your body.
Right.
The good thing is that if one were to decide to continue their chemical drug treatments, they would not have to discontinue them while starting natural therapies. It would be important to offset the side effects of the drugs that they're taking, and they'll notice that with time they should be able to wean off of whatever they've done the medications in the past before. If they've been taking them for a long time, whatever chemical drug treatment they're on, they won't be able to come off of them cold turkey, most likely. But again, the mind is stronger than the body.
Yeah.
And people have done, I'm not taking this anymore, and that's it. It makes me feel sick, and then it's whatever they decide to do.
Yeah.
I'm there to support their decision. Whether they try to continue or not, my whole focus will be to eventually wean them off. And I've worked along with my patients, conventional doctors, to do that, all the while I'm feeding them natural therapies.
Okay. Awesome. As we are ending tonight's conversation again, Dr. Julissa, thank you so much for coming in and speaking to us in reference to multiple sclerosis. If you will, please share with Source Nation any tips and advice that we may not have shared in tonight's conversation. That would be great.
Okay, wonderful. Thank you again, once again, for having me. And you can all find my information at drjulissa.com. That's drjulissa.com. Once you are there, you can click the herbs and supplements section and find the herbal therapies and natural therapies that I've mentioned here that help with restoring nerve damage and strengthening the nerves once again, and strengthening brain cells, and feeding the body the essential fatty acids needed. You just type that in the search window once you get to the herbs and supplements section, and you'll get all the therapies needed for that.
Awesome. Thank you again, Dr. Julissa, for coming in and sharing that information with us. Of course, Source Nation, you can follow Dr. Julissa out on Facebook. Just type in Dr. Julissa Hernandez. Her information will come up, as well as go to drjulissa.com. Tonight's conversation was great. I want to thank the family member for sending in your information. But one of the things that I want to mention in reference to tonight's show, and what I want you all to really take away from what Dr. Julissa stated, was the fact that, yes, this is a disease that is degenerative, but what we can do to really offset that is to, one, like she said, continue to enjoy life. Give yourself the time that it needs to heal properly. She says that, go outside and enjoy the beautiful sun, which is vitamin D. This is something that your body needs. This is natural. She also mentioned, incorporating the raw foods, the vegetables, fresh food. She said 70 to 80% of what you're intaking should be, fresh foods. So do that. As well as all of the natural herbs that she mentioned. Incorporate that into your diet, as well as your healthy lifestyle. And, I'm a firm believer that once you do those things, you can then begin to live the life that you are so destined to have. To my family member, please know that we are continuing to give information such as tonight's show, like multiple sclerosis. I am asking you to touch base with Dr. Julissa, go over to her website, continue to read up on multiple sclerosis and read on the natural herbs and things that you can incorporate. Don't think that this is something that can put you down, because it's not. You can have the life that you so want. Just incorporate the natural things that we talked about tonight. So again, I want to thank Dr. Julissa for coming in and giving us that great information. And guys, thank you so much for supporting us. We're back here again next week. That's right here on SRN Live Television. You've been watching Live Healthy Living with Kathy B and Dr. Julissa. We'll see you again next week. Be blessed. Good night.
Source Nation, thank you for listening to tonight's program, brought to you by KVEL Products. Transition from chemical to natural with KVEL.
Get at me for beats, y'all.